Hello everybody, welcome back to Lee Pitts Live. We're so thrilled to come to you from the fabulous Naples Botanical Garden. It is just a treat to be here, and I guess you can see all the trappings behind me, and it's just one of my favorite places to come to. Shout out to the Naples Botanical Garden. What a great setting to have Kristin Medina, the Director of Case Management for Mcgregor Clinic here. Welcome to the show.
Thank you for having me.
Your first time on, let's bump you
Yes.
in. Certainly won't be your last. First of all, how do you like the little setting when you walked in to see the garden? Had you ever been here before?
I've been here once, but it's been about 10 years. It's a beautiful place.
Beautiful place, huh? Looking forward to coming back maybe one day?
Oh, for sure.
All right, now you're talking my talk. Kristina, how would you describe Mcgregor Clinic in a nutshell?
We are an HIV clinic. We offer a holistic approach to treating our patients. We don't just treat their HIV, we also treat their primary care because we believe in treating them as a whole. We pride ourselves in being a one-stop shop. We offer medical care, they can get their blood work done there, we have case management. We also have our outreach and prevention department where we do testing. We also have a food pantry and a clothes closet, which they're actually a lot bigger than a pantry and a lot bigger than a closet. But we want to be there for the community and offer the best services possible.
Now, you've been there over 10 years?
Over 16 years.
Yeah, so a lot of those things that you just enunciated, you've seen all of those develop over a period of time, right?
Correct.
That holistic approach. Talk about that development.
Well, when I first started, we had less than 500 patients, and now we're close to 1,000. And it's just really great because we have 2 doctors and two nurse practitioners that are able to offer really good care. You know, for some of our patients, we're the only place that knows about their HIV status. And so we want them to feel like they can trust us and know that we're going to give them the best care.
You, just the way you describe this, in the number of years that you've been there, it's personal to you, right?
Yes.
And it's personal to a lot of people over there from my interaction with people at Mcgregor Clinic, that it's not just a job.
Right.
I'm going to give you an opportunity to just talk about how it's personal to you.
Yeah, it's everybody that works there, I mean, they want to be there. It's not just a job that you can go in, clock out, and not care, because we establish relationships with these clients that, you know, because they come to us because they know we're the ones that are going to be able to help them, because they may have family members or friends that they live with, and they can't divulge their status to them. They can't talk with them about the issues that they're having, and they can come to us. So we really, you have to care to be there, and every single person that works there cares.
Absolutely. What's new at Mcgregor Clinic?
So we have a PrEP clinic now. So PrEP is treatment for people that do not have HIV but may be at risk for getting HIV. So they take medication as a preventative. It's just one piece in the toolbox. You know, there's still other precautions that they need to take, but we can treat them there for that. And we offer education and HIV testing as well. In the very near future, we're going to have an STI clinic where anybody in the community is available to get tested for STIs. They'll get their results within minutes, and we can also offer treatment as well.
For patients living with HIV or concerned about HIV, the Mcgregor Clinic in Fort Myers is here to help. The Mcgregor Clinic takes a holistic approach to treat the body and mind, with services like same-day appointments, preventative care, wellness screenings, rapid HIV testing, immunizations, flexible hours standing by for you. Our case management team also assists with medication, housing, dental care, health education, Medicaid applications, and other insurance assistance, all under one roof. The Mcgregor Clinic is giving voice to patient choice. Learn more at mcgregorclinic.org.
Does one have to be substantially financially secure to take part in a lot of the services that are offered at Mcgregor Clinic?
So it depends, but we do, for our patients, which are people living with HIV, you do not have to have insurance. We do have programs that will cover your medical care, which includes your blood work and your doctor visits, and your medications. If you do have insurance, we go that route. There are financial criteria to be able to get some assistance, but a lot of it's very, you have to make a lot of money to not qualify.
All right, so basically, no matter what your income is, you can tap into some.
No matter what your income is, you can go there.
There you go.
So just the different assistance options that we have are based off income.
What case management services does Mcgregor Clinic offer?
So our case management department has 8 case managers and an eligibility specialist right now. We do have 2 case managers that speak Spanish and 1 that speaks Creole. So one of our main roles is doing eligibility for the Ryan White program, which the Ryan White program is the biggest HIV funded program in the United States. And that gets them eligible for all those other things that I spoke about: medical care, medications, labs. We also have health insurance assistance. We do referrals to other specialists that they may have, referrals for housing assistance. We also have food and transportation assistance. Again, some of those things are based off of guidelines you have to meet. But we're there, the case managers are there to help with a lot of different things that the clients may not be able to do themselves.
When I think of Mcgregor Clinic, I think of Fort Myers, Lee County. Is that your demographic? That's your territory? That's you limited to that?
It's not limited to that. Probably, I mean, a good portion of our patients are in Lee County, but we have people in Collier County, Charlotte County. There are other agencies in those counties as well if it's more convenient, for them.
Right. Of course, our television show reaches the surrounding 7 counties, so just wanted to make that point. What do you see in the future as it relates to HIV, AIDS, and treatment, and where we're going with this?
Right now, there's a lot of steps that they're taking. Finding a cure is very difficult because HIV is a very difficult disease to tackle. But they are making some progress with medications. When I first started 16 years ago, there was only one medication that you could take that was 1 pill once a day. And now there's, I don't know, maybe 9 or 10, don't quote me, but most of our patients are on a 1 pill once a day regimen. They also have an injectable that you can get once a month, so you're not taking medications, you're coming into the office and getting a shot. So, all of that is based off of your particular medical status for the provider to determine, but there are definitely some good advances being made.
Great. How can the community support what you're doing?
We are always taking donations. We are a nonprofit. We have our community and outreach location does take food and clothing donations. We partner up with a lot of different specialists in the area, and we're always looking to find new providers that are willing to work with us. The mental health area is a big focus for us ever since COVID. The need for mental health has really increased.
I'm very excited that in the future, I don't know if you heard that we'll be donating the proceeds from one of our Lead Pitch Live After Works, which is a pretty big shindig. All the proceeds from the door go towards Mcgregor Clinic. So I encourage people to support Mcgregor Clinic and the great work that they're doing in the community. If we didn't have Mcgregor Clinic, I don't know where we would be as a society as it relates to the health of our people, being educated, and prevention, and all these types of things as it relates to HIV and AIDS. Let's go one final question. We saw the COVID come in. It's sort of petered down now, but as a result of COVID coming in, a lot of people were being more conscious about the spreading of germs and diseases and things of that nature. I said all that to say that did HIV and AIDS kind of go in the background and people started losing consciousness of that in the environment of the COVID virus? 2 viruses out there, and it's important that they realize that HIV and AIDS is still here.
I don't know if we necessarily saw an increase in new positive cases, but HIV is definitely still around, and we are here and able to treat. If you are interested in establishing care, they can give us a call and we'll get them set up. But there are definitely a lot of good changes for the patients that did happen from COVID, where there's the ability to have telemedicine appointments, which wasn't there before.
Okay.
And yeah, so.
Oh, some good stuff. Well, let me bump you out here.
All right.
It's a pleasure having you on the show, Kristin.
Thank you.
The saying goes on this particular show, for those who say it can't be done, they're usually interrupted by those like all the fine people at Mcgregor Clinic who are working hard to keep us safe. And remember, Miami might have the oranges, but Mcgregor Clinic has got the
Juice.
They got the juice. We'll be right back.
Lee Pitts Live is a Lee Pitts Enterprise production.
Hello, everybody. This is Lee. I'm so glad that you watched that particular show. And if you enjoyed that show, we got other shows like that. Just subscribe to our YouTube channel. Watch Lee Pitts Live on demand anytime. And also hit us up on all our social media platforms. Just type in Lee Pitts Live, and there you go.